detox, that is a loaded topic today. We see it everywhere on social media, we see it everywhere on the internet. And I had a conversation the other week with a woman at a corporate client who is having me come in for a talk on their health and wellness day for employees. So it's an employee health and safety week. And she asked me what I was planning on presenting, and what I thought I would do is talk a little bit on the concept of detox and what exactly that means, because the body does actually have its own methods of detoxification. We have our kidneys, which process toxins and wastes for elimination. We have the liver, we have the bowels, we have the skin, we have the lungs, and we have lymphatic system. So we have built-in methods that our bodies seek to process nutrients and eliminate waste products. So there are times that the body needs additional support. So while, yes, the body does seek to balance itself and it does seek to eliminate waste, however, when certain elimination channels are not functioning properly, we might have an effect on the other systems. So for example, if our bowels are not moving properly, so if the plumbing is not taking the trash out, it's one long tube. It tends to back itself up. So we can have symptoms along the digestive tract. But in addition, you might have flare-up of other aspects in the channels of elimination. So people who have a sluggish bowel might have experience congested sinuses or a flare-up of sinusitis. So there are times when a general detox, when you're using a variety of vegetables and fruits and cooked grains for smoothies and for cleansing meals. And while all of that is brilliant for helping the body to detoxify through those channels of elimination, there are a few additional times when the body needs some additional help, and that's where the herbal medicine comes in. So let's go system by system with a couple of examples. Obviously, it's not an exhaustive list, but it gives you an idea of when a detox can go further. So let's start with the respiratory system. Sometimes a detox would be enhanced when we take a look at chronic conditions, such as chronic sinusitis. Sometimes people who have sinus infections on a chronic basis have an involvement of fungus. And a lot of times medical doctors don't always culture the sputum in order to know if there is a yeast infection, but they know they're constantly getting sinus infections. So we take a look at supporting the respiratory system with yeast and also clearing out the sinuses. However, we know that the sinuses can get blocked up when other channels of elimination are a little sluggish, like the bowels. So we'll talk about that in a minute. So the other systems include the urinary system, and that are your kidneys and your bladder. So while a general detox is wonderful in increasing the flow of urine, sometimes people have issues with a congested gallbladder. Now, it is actually not safe for someone to go through an extreme detox of gallstones, because the stones can actually be a little too large to pass through the duct in one go. So it would really benefit somebody who has chronic issues with kidney stones and gallstones and bladder stones and things of this nature to go through a gentle, long-term approach of helping to dissolve those minerals and the materials that make up a stone. So that's where something more specific to a general detox would be useful. Another part of the respiratory system with chronic infections is the need to help move the lymph fluid around. Now, the lymphatic system is a channel of elimination, but it's what we would call a passive channel. And by that we mean it does require muscular contractions and movement in order to move the lymphatic fluid. And the lymph system is involved with our immune function. It helps to produce factors or certain T cells and B cells in our immune system, but it is also a waste removal system. And so if you can imagine let's say in a corporate building, you have a little waste basket at everybody's desk, and consider that like a lymph node. And we have lymph nodes throughout in collections in different parts of our body. So when somebody throws out some paper in their waste basket, at the end of the day, the cleaning people take that waste basket and they dump it into a bigger waste basket on the floor. And then from there, it gets dumped down at the back of the building into a larger container. And that similar process happens in the lymphatic system. You have the little waste baskets of the lymph nodes, and then it travels to organs like the spleen. It goes into some vessels in the torso, and those are those bigger containers, bigger waste containers, and eventually the body will process it and eliminate that through the bowels, through the kidneys, different ways we eliminate the waste. So let's talk a little bit about detox and yeast, the overgrowth of what's known as candida, or it's a fungus. There is a fungus among us sometimes. So let's talk a little bit about yeast. I know my humor is really corny. So we have systemic yeast, which can cause a variety of symptoms, and it can be something as simple as feeling bloated in your bowels after eating. Some women might experience vaginal yeast infections. There can also be experiences of fungus on the toes and on the fingernails. What's important to remember is that detox is a detox process. A general detox is wonderful that you can do. Like I said, there's plenty of programs that list a combination of juices and herbs. Again, there's no cure-all combination of fruits and vegetables. My greatest tip for you is just vary. Have a variety, because each and every plant has a whole spectrum of beneficial components. So, but in addition to that, there are some pre-existing conditions that you really need to be mindful of, which may have a predisposition to things like yeast. Diabetics often have an issue with yeast. People undergoing chemotherapy, because chemotherapy is often very high doses of antibiotics. And so people who have chronic infections like chronic bladder infections and chronic ear infections and chronic sinus infections are often taking antibiotics on a regular basis. And because the antibiotics kill off all the bacteria, the good and the bad, and by that we mean the bacterium which we don't respond well to. We have good bacterium and bad. We have an imbalance caused by chronic antibiotic use. So we can have a heyday of yeast when it overgrows because the good bacterium don't keep it in check. All right, let's talk about the plumbing. The large intestine, actually, it's the whole digestive system. So when you think about the digestive system, you have to consider it as one long tube. You have mouth to anus. And so I'm not going to use flowery language there. It can be pretty colorful. But each segment of the digestive system has its own pH. And through a variety of functions, it could be emotional nervous system, it could be diet related, it could be dehydration, not having enough water intake. So some of these detoxification programs make you feel good initially because A, you're increasing your water intake, you are cutting out the sugars and the preservatives and the foods that we know make us feel pretty darn crummy. So automatically these detoxes have a beneficial effect on our energy levels. Now, one of the issues with chronic constipation is that by having the bowels moving too slowly, you can cause a backup of waste. So people with chronic constipation can start to suffer reflux or a backup of acid. Because each segment like I said, has its own pH, and if one segment fills up, it's going to spill back into a previous segment which functions on a different pH level. So we want to keep the bowels moving. You got to keep that plumbing going. The thing about chronic constipation is that we can have a reuptake or a reabsorption of toxins or waste products, one of which are reproductive hormones. So for, let's say, women who have fibroids or endometriosis or concerns of an estrogenic nature, an excessive estrogenic nature, and keep in mind that we are exposed to excessive estrogens in our food and water in our environment. They act like estrogens, even though they aren't the hormones specifically in our bodies. And we have different substances that disrupt our hormones, but that's a topic for another video. The primary focus on keeping the bowels moving, in addition to obviously eliminating waste, when a detox needs a little more focus, is on women who have these tissue growth issues, which is an estrogen dependent or tissue building process, is that we have a reuptake. So when the bowels don't move on a regular basis, the body reuptakes those used hormones. It's through what we call the enterohepatic recirculation. That means entero is your bowels, hepatic is your liver, so it gets reuptake into the liver and reconstituted back into hormone, which elevates the circulating estrogens. Now, will a 3-day, a 2-week, or a 1-month detox help clear that estrogen buildup? The truth is, it takes longer than that. The reproductive hormones, your adrenal hormones, we function on monthly cycles, and it's not immediate. So these radical detoxes that cause headaches and nausea, they're not ideal when you're looking to be more specific with something like an estrogenic overload. So we can work with your physician if you are in the process of treating fibroids or endometriosis, rather than taking something that will chemically shut down your estrogens. We can look to possibly reduce the estrogens and clear it out over time. So this is a situation where the herbal medicine, in addition to detoxification methods, on a more gentle but a long-term approach, is really your best bet. So the final channel of elimination, which for a lot of people is a very important one because it's what we present to the world, which is our skin. And so a lot of issues like eczema and psoriasis and these chronic conditions do respond well to a general detox. However, there are times that the skin requires a little bit more because the issues are deeper. We always talk about beauty is not just skin deep, and that's the truth. Because the truth is that all of these channels of elimination must be working properly, otherwise the toxins have to find their way out somehow. So while we have our channels, our organs of elimination that the body naturally looks to constantly detoxify, livers, kidney, bowels, lungs, it's unfortunately we are bombarded with a lot of pollution and a lot of additives in the food, and so it can slow down the process. In addition, our nervous system can impact our hormonal functions, and so a lot of these influences are part of acne, they're part of dull skin, they're part of aging skin, and so what we look to do is not only with a general detox, but we really want to look at what else is feeding into these chronic conditions. And that is when a basic general detox over a shorter period of time can help your behavioral and your habitual lifestyle. But there comes a time when it's better to extend it over a longer period of time, which is how the body naturally regenerates. So we will need to look at your nervous system, because otherwise we will still experience the breakouts and the rashes and the hives and things like that. So the skin is really reflective of what's going on a whole lot deeper, but it is very important to a lot of people. So especially when you're heading in for an important event or your big day like a wedding, you want to look your best. If you're going to be on camera, oh goodness, hopefully my skin looks pretty good. But hey, it's all about our lifestyle. And some of these general detoxes are wonderful to help us hydrate, to help us clear out some of the junk food in our diets, to help us eat more regularly, to maintain our blood sugar levels, to really enhance our nervous system and our endocrine system. So ultimately, this all factors into the skin, and a general detox is wonderful. But then there are other times when some of these systems require a little extra help.